Hi, this is Dr. Sara Sabokpey at Comfy Dental Studios. Today I wanted to talk about Curodont treatment. We've been getting a lot of questions about it, so I wanted to address some of those today. Curodont treatment is a biomimetic treatment. It's a non-invasive way of treating small cavities, and that's how it fits well within our practice at Comfy Dental Studios. The way Curodont works for early caries treatments and small cavities is that it repairs, it stops the cavity progression, and it also repairs and reverses it. What patients need to know about Curodont repair is that it works on capillary function, meaning that we prepare the tooth by placing a conditioner type material on the tooth. We clean the area, we isolate it, make sure it's very dry, and then we put the treatment on there, and it works on capillary function to absorb the treatment, to put a lot of minerals back in the tooth. It also works like a magnet for your own saliva minerals to be able to repair over time. So it's a non-invasive way of repairing a cavity without having to do a filling. The way traditional fillings are done is that we have to remove healthy tooth structure to get to the decay part. But with Curodont fillings, we don't have to do that anymore. We just repair what has been lost in terms of minerals and minimal structure loss. But the cavity has to be very small for Curodont to work. Curodont can work for small cavity repairs if they are still within the enamel, which is the outer layer of the tooth. If it goes deeper than that, then traditional fillings are required. However, we have seen a lot of Curodont treatments work well within the whole enamel depth. The way we determine if the cavity is small enough for a Curodont treatment to work is that we look at the amount of structure loss versus mineral loss. If there's a lot of mineral loss without structure loss, Curodont is the perfect treatment for that kind of cavity. But if there's a lot of structure loss or the decay is very deep and we can see it either on the x-rays or visually within the mouth, then we know that a traditional filling material is needed to repair that cavity. What patients need to know about Curodont treatments and how it works is that we clean the tooth, we place the conditioner on the tooth, which is acidic, and it removes everything from the pores of the enamel. It opens the pores up, and with capillary function, we place the Curodont on after isolating the tooth, making sure it's dry. We put the treatment on, and the treatment absorbs into the tooth enamel pores to replenish the lost minerals. It also works by using your own saliva minerals over time. So within 4 to 6 months, we see that repair happening. After we are done with the treatment, which takes about 2 minutes, after we are done with the treatment, the patient is advised to not eat or drink for half an hour to allow for the material to seep in completely. And after that, when we do a follow-up visit within 4 to 6 months, we see that beautiful restoration done naturally with your own saliva minerals getting back in the tooth. What we do advise is that you use high mineral toothpaste within the time frame that we're waiting to see the repair so that it aids in putting the minerals back in the tooth with the treatment that we have already put on. Curodont is the perfect treatment, especially for kids, teenagers, and after orthodontic treatment where we see a lot of white spots. What we need to know is that white spots are the start of a cavity, meaning that it's mineral loss. So it's the perfect situation where we can use Curodont to non-invasively fix discoloration and mineral loss and the cavity. It takes about 4 to 6 months to see the results from Curodont treatment, and we see that either on x-rays or visually. For some people, depending on their diet, it takes longer. For some people, it takes shorter. The way Curodont compares to silver diamine fluoride is that they are both great for cavity repair, but silver diamine fluoride really does not repair. It stops the progression, and silver diamine fluoride also does stain the teeth a little bit, although the new treatments with silver diamine fluoride do have a component, which is a bleaching component, and it removes most of the stains. It doesn't turn the tooth all the way black like it used to, but it still does stain the teeth a little bit. Curodont does not stain the teeth at all. And it also repairs. It's not just the stopper progression of the cavity. It also does help with sensitivity. Both do. Both silver diamine fluoride and Curodont help with sensitivity repair. So what we tell patients is that Curodont is much more cost effective than doing a filling. It also does preserve your enamel. So my suggestion is if you have a small cavity, don't wait for it to become bigger where it needs more enamel removal or more invasive treatments. Go ahead and call us and let us use Curodont for you to repair that cavity naturally so that your tooth is preserved, it's repaired, and it doesn't have to go underneath filling. So go ahead and give us a call and let us use Curodont for your cavity repair so you don't have to go through a filling or wait for the cavity to become bigger to do a filling. I hope I answered most of your questions today. If you have any other questions or would like to schedule an appointment at Comfy Dental Studios, go ahead and give us a call at 310-499-2048.